Hello, and welcome to this LinkedIn Live panel discussion. Dementia presents an enormous challenge for us globally, but the burden and the impact is often disproportionately felt in low and middle income countries. My name's Sasha Boziat, and I work in the Global Medical Affairs team at Roche, and it's my pleasure to be your host and the moderator of this session today. As you know, yesterday was World Alzheimer's Day, and that represents a coming together of people working across the globe to prioritize dementia. We're very fortunate to have three such remarkable experts with us here today. These dementia experts will share their own experience and insights with us so we can learn more about the dementia care pathways in low and middle income countries and the particular challenges faced by healthcare practitioners and individuals living with dementia. We really want to foster a positive conversation with you today, something that you can engage in, and we would encourage you to share your comments and your questions with us. But I would ask you not to ask questions or make comment on medical advice, and specifically, please refrain from mentioning any medicines by name here today. Also, I would ask you please to show respect for our expert panelists today and don't share inappropriate or any off-topic comments. So we've got about 30 minutes for our conversation today, and I'm going to start with some pre-prepared questions, but hopefully we'll have some time to get to your questions at the end as well. So feel free to submit those as we go by typing them into the chat. So without further ado, I would like to ask my panelists to introduce themselves very briefly, one by one. Berenice, should we start with you?
Hello, everyone. I'm Berenice. I'm a geriatrician from the south of Brazil. I'm living here, working at the Moriguchi Institute and also from Global Brain Health Institute.
Welcome, Berenice, and thank you for joining us today. Kanyo, let's go to you next.
Hello, everyone. I'm Dr. Kanyo Ngos. I am a psychiatrist and lecturer from Durban, South Africa, and I'm also a senior fellow with the Global Brain Health Institute.
Great to have you with us today, Kanyo. Thank you. And last but not least, we go to Asia, to Morpin.
Hello, I'm Morpin Tan. They normally call me Tan Morpin because our surname's at the front in Asia. And I'm a geriatrician based at the Kuala Lumpur, and I'm actually a professor at the University of Malaya.
Excellent. Again, a warm welcome to you all, and thank you very much for taking the time to join us today. So I would like to start by understanding a little bit more about how high a priority dementia is in your respective countries. And I think a fairly good indication of this is usually whether a national dementia plan exists or not. Kanyo, let's go to you first of all. Is there a national dementia plan existing in South Africa?
South Africa doesn't have a plan or strategy that's currently being implemented. There was one that was in development, but it hasn't yet been approved or currently working. So currently, no, we don't have.
Okay, so it's work in progress, if I understand. It's being at least discussed. It's highlighted as a need, but we're not actually on the way to having a solid plan yet. And how about in Malaya, Morpin?
Yeah, in Malaysia, some strange things has happened because actually we had a national dementia action plan in progress from 2019 when we hosted the Asia Pacific Regional Conference for Alzheimer's Disease International, and our Ministry of Health at that time actually attended the conference and was actually very supportive, and so there were actually very positive moves and fast track towards writing up a dementia plan and activating it as soon as possible. However, just before the pandemic really hit Malaysia, we had something called the Sheraton move, where our government was replaced by the opposition, not through vote, but by some political maneuvering. And the Ministry of Health then was replaced. And because everyone was so busy with the pandemic, nothing happened with the dementia plan. And when things calmed down, there were efforts to revive the draft, which was actually, unfortunately, at a rather advanced stage. And then it was decided that the resources were limited and the plan was on hold or maybe shelved. And we don't actually know the exact details. So that's a little bit unfortunate. So there are now moves to try and get this revived. Our Minister of Health has actually just revealed that his father-in-law, who so happened to be our fifth Prime Minister, actually has suffered from Alzheimer's disease for the last 10 years. So we're hoping to ride on this rather interesting news to try and get this dementia action plan revived.
Yes, yeah, it's often that personal experience that we're touched by that, of course, then, makes us prioritize it. And I mean, it's great to hear that the influence of the Alzheimer's Disease International, and they have done fantastic work, I think, in championing the need for the plan. Really good to see what can be achieved, through the work that they do. And let's hope that the new government also see that as a priority. Berenice, how about you? How about in Brazil?
Yeah, we have something going on here from the end of past year. So we hope that from this year we are going to have something much more structured about it. And there's yesterday actually we had lots of discussion around it, especially in our federal government. So hopefully in a few months from here we are going to have some good news around this national plan around this dementia.
Oh, that's good to hear. So It sounds like there's still some progress to be made into getting a strategy and a plan together in most countries, but at least dementia's on the agenda. People realize the need for it. So that's always a good step. I'd like to understand a little bit more about how your healthcare systems operate with regard to dementia. So maybe if you could kind of briefly outline that for us. Berenice, let's start with you this time.
Here in Brazil, private and public health systems, they exist in parallel. Actually, the public system serves most of our population. From some point of view, access works better in the public system because the patient needs to be evaluated by the general practitioner, and then they will be referred for evaluations with specialists. But on the other hand, in private medicine, the patient himself chooses with whom he will be evaluated. And this generates complicated situation in most cases because they feel a little bit lost in between them.
Interesting to hear the kind of pros and cons, if you like, of navigating through the private or the public system. They're not always straightforward that you would think that those that are paying for the service are getting a better service. So I think you raised some important points to consideration there. And Kanye, how about your system in South Africa?
So ours is similar to the Brazil one that Berenice just discussed. So our private and public run in parallel. And for us as well, majority of the population use the public system. And entry into the public system would be via primary or community healthcare, so at community level, and then referral to district, secondary, and tertiary. And along the way, different tests and scans can be done. And then they get to the management. And then in the parallel, similar, it's via your general practitioner who will then kind of refer you. But also our policy is not really active, right? So it's still kind of like confusing in that part as to how the patients really navigate.
Okay. So maybe that entry point then is not really quite clear. Needs to be some more clarification around that and communication. And more Pin, is this a similar situation in Malaysia?
Well, Malaysia is interesting. We do have universal health coverage, and we do have a public health system that is actually funded mainly by taxpayers, and about 70% of the population will access this system. We have insurance system that covers about 30% who are able to afford private insurance. But we also have hybrid systems where people pay a little bit and then it's subsidized, and corporatized systems where if you're referred by the the government, then at the government hospital, then you don't have to pay, but you can also still pay to access the same service. So that it is much more complex, and it is actually interesting because of the complexity that there are multiple portals of entry. So most people are able to access care in some way. So complex and multiple portals of entry might be a good way.
Yes. But you mentioned there the complexity there, and that, that's often confusing for people. And so, what's the impact really then on individuals trying to navigate their way through and receive a diagnosis and subsequent care?
Yes, because the individuals, we're quite a close system, and so most people, the doctors all know each other and cross-refer. So it's usually not so bad. If they don't know what to do, they can actually access the public health system through primary care. So but people can also just walk into a private GP and get a referral to a public hospital. So it usually works. People do know somehow how to access the system, and there are a lot of informal networks that you can use as well to get through.
Oh, that's great. So it sounds like there's a lot of opportunity for people, and people are able to take advantage of that. So
Yes.
Complexity in this case is not necessarily such a bad thing. Canyo, do you recognize, some of these challenges in terms of accessing a diagnosis and subsequent care?
Yes, we do, because one of our biggest challenges is also getting to care. So before people even know where to go, they need to know about dementia. So because in our setting, there's a low dementia awareness, these symptoms can be seen sometimes as normal aging. Other times, especially in some of the communities, these symptoms are seen as witchcraft or bewitchment. So either those individuals or those families will not seek help because of fear of the stigma, but also it puts those individuals at risk, because we've had times where people were killed and things like that because someone will see an elderly person in their yard at night with disorganized behavior, and it's seen as someone performing witchcraft on someone else. So even before getting into the system, because of the low awareness and the stigma, they kind of don't know where to go and where you should present with these symptoms. But if you are using the state or public, your point of entry would be via primary healthcare or community healthcare. But some communities would start at a traditional healer and then maybe be seen there, and then others would maybe go to a traditional healer, then get referred to the GP or to the clinic. So the entry or the awareness, even getting into the system, is also difficult. And because there is no active plan strategy, that whole increased awareness and getting people to know about dementia from a national level is not there. So that also gives, challenges to people living with dementia and their care partners. Yeah.
I can imagine. And Berenice, are there additional challenges faced by people in Brazil that we haven't heard about yet, or you recognize some of the challenges that we've spoken about?
Yes, of course. As Canil said, here in Brazil, most of the people, especially the poorer ones, they pretend it's kind of part of their normal aging. So usually they just look for some kind of help when the person itself has some kind of behavioral problems. Then they go to look for us and to have some, hopefully to have some kind of help for their activities of daily living, But usually they suppose it's like kind of their normal aging. So it's a kind of a stigma here in Brazil. Most of them they don't realize their relatives or parents can be passing through some kind of mental health disorder. So it's kind of a problem here for us.
Yeah, I can imagine. So this stigma sort of leads to a delay in diagnosis, and then, not diagnosing until too late. And I mean, I know this is a problem also in high income countries. We often don't diagnose people in a timely manner, or the diagnosis is a general umbrella term such as dementia and not the specific underlying cause of that. And that obviously makes planning and care for those individuals really quite difficult. And so, what's sort of the impact really then on this delayed diagnosis? I would imagine that people living with dementia are then sort of disadvantaged throughout their care journey as a result of this. Would you agree with this? And maybe, share some examples if you have them. Berenice, maybe let's come to you first on this one.
Yeah. Most of the cases we know that at least we could have some kind of examinations around it, especially from image things or something like that, for us to at least to think on something else, and for us to plan with them some kind of treatment for them. We know that the drugs are not as effective, but we have many things that we would be able to do, especially if they would come to us. The point is that they need to come to us, for us to be able to help them. So most of them, they don't seem this problem coming, and just come to us in a very end stage of the disease. So that's part of the points where we have to work a lot around education, around helping them to see it, and help them to recognize it, and then be able to come to us earlier. Then there's much more for us to help to do, and especially for us to try to delay the progress of the disease itself.
Yeah, absolutely. So there's quite a lot to be done, I think, then around education and an awareness, and getting people to, recognize the early signs and come forward. And Kanya, you've said you've got the additional challenge really of, extreme stigma and people being accused of witchcraft even. And so, what's the impact of that? And is there anything that's being done to sort of try to counteract that belief?
I think it's similar to Berenice. So it leads to people presenting late in the illness, and when they have the behavioral or psychological symptoms, and then they've been at home for so long. There's also caregiver burden also now that has been associated with this, which is now another pathology on top of what is happening. And because in our system, there aren't a lot of places to send, that people with dementia can seek treatment, especially at a community level. So then it kind of leads to us being limited in how much we can support them because they present so late. So it's about the psychoeducation at that point. So things like planning for the future, finances, assets, we don't get, they lose the benefit of gaining those services. So it leads to, people presenting late, and then there's already a lot that has been happening and going on, which limits how much intervention we can give, but also in the background of, because there is no clear policy, the health and social systems are not working together to support people with dementia and their care partners. It then leads to kind of, as a clinician, being, limited in how much support you can give to people living with dementia and their families. Yeah, so it really does present a big problem.
That must be very frustrating for you as well. Does it sound familiar to you, Morpin? Do you recognize this as well?
Yes, we actually have quite a lot of issues with filial piety. So because in an Asian environment, in an Asian culture, you're supposed to do things for your parents as they get older. So so it's really difficult to differentiate whether the older person has lost function or whether the function has just been taken over. And so in actual fact, the older person might be totally dependent and having everything taken care of for them. And they would only turn up at the very end of their lives with a life-limiting illness. And at that point, after taking a detailed history, you actually have issues with them trying to get the family to understand that they've had dementia and they're at the end stage, and no matter what you do, nothing is going to change the outcome. So it's actually can be extremely frustrating, yeah, in the sense of actually achieving any sort of understanding on care of people with dementia. So it is, of course, we're talking of a very varied population. We also have people with very high levels of education who's able to present early, and who's actually, because we have the good family systems, and who actually are able to have a really good quality of life until the very end, and maintain the function until at a very high level, and have a very short, sharp decline at the end, which is what the optimal treatment for dementia is. So we do have pockets of very good example, but also horrific examples of people presenting nearly at the end of the life and nobody knew they had dementia.
Yeah. So well-meaning family members sort of, masking, I suppose, the symptoms all the way through and helping that person go through, but actually, yes, not really realizing themselves what the underlying problem is. And you talked about the kind of pockets of, where things are going well, the good examples. And I guess that kind of leads us a bit more onto a positive vein where I would like to go. We've talked a lot about the challenges, but, what are the reasons for hope? What are some of the kind of positive changes that you are seeing in your respective countries? Morpin, let's start with you on this one, as you are just giving us some examples there.
Yeah, it's actually really hard to be positive given that we've just had a pandemic, and our nursing, our long-term care system has been ripped apart, and we have a huge caregiver crisis. Dementia services, suddenly our waiting list has gone really, really, really long, and people are not able to access services or care that they need. But having said that, the positives are that we do have increase awareness in both government and the public who are actually demanding these services. We even have our Ministry of Higher Education actually now contacting institutions of higher learning to ask them to incorporate care for older people and people with dementia in part of the medical curriculum, which it wasn't in before. So there are positive moves in the right direction. And this, I believe, has been pushed on by the UN Decade of Healthy Aging. So I think we could ride on the UN Decade of Healthy Aging. We could actually potentially push things a lot further, much more quickly.
That's fantastic to hear. And Berenice, reasons to be hopeful in Brazil, positive change you're seeing.
Yeah, as Mopin said, here in Brazil, due to the pandemic, we had these highlights over the nursing homes. So most of them now they're much more well regulated. So most of them are now working in the best way than before the pandemic. So but there's still a lack of places where people with moderate to severe dementia can be helped, can be living outside of their own home. So we have much more nursing homes working in the best way at this moment, but we still have much the need of places, much more places for them to be able to live in case they need it. So there's a lot of lights over those nursing homes, because usually there were lots of stigma before the pandemic, but right now there's a lot being done around the country for us to be able to have some much more qualified places for people to live in case they need it, but it can be quite expensive here in Brazil, especially if the private ones, the good ones, can be quite expensive. So there's a few people who can actually pay for it, and there's lots of not so good places which are cheaper, but then we are not as secure about what they can actually offer for those patients. So we still have a lot to work on it, and there's not help from the federal government for those families to pay for those kind of places, So I mean, most of the time, the families have to deal with it and to help and to deal with between them about how and what can they do for them to be able to take care of the patients with dementia. So that's a lot to be done here.
Yes, yeah, a lot to be done, but it sounds like there's some positive shoots, let's say, growing at least. And Kanye, sorry, how about in South Africa? Some positive change happening there.
In South Africa, it's the people with lived experience that are actually advocating and trying to make a difference. So community-based dementia NGOs, which are going out into the community to screen for awareness, setting up dementia support groups, people starting NPOs and writing books about dementia and in Zulu, so in the other languages that are not English, because majority of our population does not speak English. So it's more the advocacy and the people at the community level, but then the barrier to that is that they don't get support. So they don't get funding. And so them carrying on, it's very difficult. They do though, which is very commendable. So it's more at the ground, but because dementia is not on the government's agenda, the support for those people is not there. So I think people with dementia, people with lived experience, they are the ones that are actually advocating to try and get it on the agenda. But while it's not there, they are working to support people in their local communities with the limited resources that they currently do have, which is very commendable.
Absolutely. I mean, it's very empowering for them. It's also sort of tragic at the same time, isn't it, that people are having to do that themselves. But there obviously are driving change and getting it onto the agenda. So that's fantastic. And like I said, very, very empowering. Well, great to hear some positives anyway amongst some of the challenges that we've heard about today. That takes us to the end of our sort of pre-prepared section of this discussion. I'm sure that we've got some participation, some interaction from those of you joining at home. We've got a question that's just come in now, so I will just pose this one. So what's needed to ensure dementia care strategies are culturally appropriate? A very interesting question. Morpin, should we start with you on this one?
That's an extremely important question, and that's been my journey for 10 years, because I actually trained in the UK and came back to Malaysia 10 years ago, and it's been a slow learning process. We have to balance cultural expectations with what's appropriate for care for people with dementia, because the culture has developed over time, and culture doesn't take into account population aging. So things like filial piety is not realistic if you have fewer younger people looking after older people. So we actually have to work with culture, embrace what can be retained, but also we have to actually work at culture change in order to move forward when it comes to people living with dementia. So for Malaysia particularly, trying to inculcate the culture of independence when you actually grow older, whether you have dementia or not, has been a real challenge. And really we need more people, more role models to come forward and say it's okay to let your parents do things, because there are adult children who will disallow their parents from going out, disallow their parents from meeting friends, just because of a false sense of filial piety. So yes, culturally appropriate, embracing local craft, local religious beliefs, but at the same time adjusting the culture to ensure that it is sustainable, the system is sustainable.
Absolutely. And anything further to add on that, Berenice, from Brazilian perspective, cultural considerations, how important are they?
Yeah, here in Brazil, we have some different kind of management of those situations. I mean, in the rural areas, there's much more of support from families, and so it's easily for them to take care of their old ones, usually at home. And so but it's kind of hard for them to do it here in urban areas. So this cultural thing around who is going to take care of the sick ones, it's kind of much more helpful there in the rural areas than here in urban areas. And also we can fight much more around stigma within them, outside of the main cities, because they kind of, as our colleague said before, they are much more common for them to be able to take care of the old ones. So we have these cultural things which are kind of so different from the rural to the urban areas. So that's something we are fighting for, and we're trying to help much more them here in the urban areas, for them to have some kind of support and feel a little bit more comfortable about how to take care of them. There's lots of stigma, so they try to hide those people with who are sick, So it's kind of hard for them to be able to join, like go to some place else with their relatives if they are sick, especially around the dementia things. So we are trying to fight against this stigma, for them to feel a little bit more comfortable and more light about taking them outside.
Absolutely. And Kanyo, what's needed to ensure dementia care strategies are culturally appropriate in South Africa?
So South Africa has 12 official languages, and we have a whole lot of other tribes or groups within that. So within our population, our population is still very culturally active. So cultural beliefs, cultural practices still form the daily, practice of most people. So in our culture, especially also because the dementia symptoms have, this stigma around witchcraft and certain other things, it's important when developing dementia strategies for our population to take those things into consideration, because it helps with entry point, but also it helps with keeping people in care, and not losing people with maybe someone who doesn't believe in their what they believe in, and then they give you the symptoms, and then you're not respectful of their culture. So it's about being respectful of the cultures, but also the practitioners being aware of those cultures, because sometimes the person seeing you has no awareness of your culture. So I think it's everyone educating each other, so that we are more culturally appropriate, but also engaging with people with lived experience, engaging with other people that provide care, in order to make the system more culturally appropriate, especially in our culture, like our cultural dynamics in our country. Yeah.
Absolutely. So it sounds you've got to get a balance right between being kind of appreciative of cultural considerations, but at the same time trying to manage stigma, which is actually preventing people from being diagnosed and being managed in the best way possible. And I think that leads us nicely to another question that we've had from the audience, which is, what does stigma look like in your region, and how might it be overcome in the future? I think we've talked quite a lot about what stigma looks like. So I guess maybe let's take the second part of that question, if you feel that's the right move, and how do you think we could overcome these challenges of stigma? Morpin, should we start with you on this one?
I think education, isn't it? Yeah. So dementia, people living with dementia are human beings just like you and me. And, it's across the board. We need to live with people with disability, people who are different from us. So we can actually very easily stamp out ageism, racism, gender bias, all at the same fell swoop, if we actually deal with prejudices in society, and the stigma will wane when eventually, when people do realize that just because they are forgetful doesn't mean that they can't do things. So a lot of and having leaders who actually don't former leaders who don't conceal the fact that they have dementia will actually really help. And also people who are still actively working who have dementia, if they are brave enough to come forward, come out and actually admit it, that could potentially also change things. But at the moment, because everything is hush hush, people work with dementia, and I have patients who continue to work even if they have dementia, but they just don't feel that they can actually reveal this to the employers or sometimes the family, because of the fear of being then told to leave. So all that we employment laws to protect people so that they can't dismiss them just because they have dementia will actually help as well.
Yeah. I like the way you're advocating really for a kind of broad societal approach, actually, to kind of stamping out any kind of prejudice, and then of course focusing specifically on the injustices that people face. People living with dementia are still contributing to society. They are still, as you say, many oftentimes in work and still contributing as valued members of the society, and that's should be considered as such. Berenice, anything further to add on how we could overcome stigma?
Yeah, there's lots of campaigns here with kids around how to deal with kids with autism or Down syndromes. So we could actually work on that, especially regarding problems with autism and some other problems that they could have dealing with. We are not having those opportunities, but a few years ago we had the chance of working in these schools and working with kids, and we were trying, we were actually teaching them how to manage with their grandparents with dementia, so, and kids can learn it faster than some others most of the time. So kids learn it at school and then they teach their parents at home, so for them it was easily to deal with those people, their grandparents with dementia at home. So most of the time we just can work around education, and it would be much more helpful for them.
Yeah. There's always a lot we can learn from our children, I think, and a lot, as you say, that we can learn from, tackling and other conditions as well, and how tackle stigma around other conditions too. Another question that's come in, I'd like to try to squeeze it in before we close. If you could take one action in the near future to improve the care pathway in your country, what would it be? Should we come to you first, Kanyo?
I think it would be to make dementia care a priority. And with that, put in resources for people with dementia in the healthcare pathway, in the social care pathway, and allow the different departments or different divisions to be able to work together in order to have a pathway of care, so that patients can get care and they don't get lost, and they then also feel like they stumped, so they stop coming and then come back later. So prioritize it, have good care pathways, and then, okay, this is more than one, but it's part of one. And also with that, increase awareness in the community, but also in the healthcare practitioners, so that people with dementia feel like they can go somewhere and get help. And the care partners also feel like they can go somewhere and get help and not feel like they're on their own. There's no one that understands them or knows what they're going through, and there's nothing that can be done. But just for people to know that help is available and land in a soft spot where people can help them. Yeah.
Yeah, two very important priorities there. So I'll let you go over the one there and have two. More Pin, what about you? One or two priorities,
Yeah,
one action that you would
I,
do.
I think the most important thing is detection. And if I could change medical education, I would make cognitive assessment a standard assessment for clinical examination, in which case everyone who sees a doctor then gets the memory tested. And once we we detect dementia, it will, and especially detecting it early, then it will actually really increase the demand for services, and that should drive everything.
Yeah. So you would advocate for a kind of national screening program, cognitive screening over a certain age, everybody come in and be assessed. Absolutely. Yes. Yeah. I think that would make a huge difference to detection and diagnosis rates. Berenice, how about you?
Yeah, and together with early diagnosis, we could also have much more teams working with non-pharmacological treatment for those which are heavy or already are diagnosed. Like we could have much more neuropsychologists or occupational therapists, physiotherapists, much more of those people working with us for us to be able to offer something much helpful for those patients. So it would be very good for us to count on much more people like this to working with us with them.
Yeah, absolutely. Well, sadly, we're out of time, ladies. It's really been such a fantastic discussion with you today. I've certainly learned a lot, and I hope that everybody joining us at home has learned a lot as well, and they feel that it was 40 minutes well spent spending the time with us. I would just like to thank you all so much. You've been absolutely brilliant today. You shared your expertise and your insights with such eloquence and such passion. So thank you so much for giving us this glimpse into dementia care pathways in your countries. And thank you to everybody who's joined us at home. Thank you for your participation, your comments, and your questions. If you've enjoyed the conversation with us today, do tune into our next LinkedIn Live discussion, which is going to be held on Wednesday, the 28th of September, where I'll be joined by 3 more experts, and we'll be discussing an important topic, brain health. I'd just like to finish by thanking the WILD group, that's the World Young Leaders of Dementia group, who have put together this fantastic program for us today and organized for these brilliant panelists to join us. So thank you very much to everybody who's been involved in this. Thank you again to our panelists, and thank you for joining us at home. Goodbye and enjoy the rest of your day.